As global efforts at making Ebola vaccine and better treatment available are being intensified, Nigeria's experience in the containment of the virus is critical in the development of these measures. This much was made known by the United States Deputy Assistant Secretary on Global Affairs, Mr. Mitch Wolf, at a meeting with the management and staff of First Consultant Medical Center in Obalende, Lagos. Our correspondent, Yomi Otaigbe, reports.
The arrival of a delegation from the Office of the Secretary of the United States to First Consultant Medical Center, Lagos. The Chief Medical Director of the hospital, Dr. Benjamin Ohieri, leads the team who are here on a goodwill visit on a tour of the hospital that has been commended for the pivotal role it played in the containment of last year's Ebola episode in Nigeria. The delegates from the United States, led by the Deputy Assistant Secretary for Global Affairs, Mr. Mitch Wolf, also got to see some of the doctors, nurses, and family members affected by Ebola.
Strong kids, because in 1 year she's graduated. Where's my daughter? She's not here. She's not here. Okay, it's very hard for them, but we understand.
While acknowledging the positive roles played by the federal government, Lagos and other state governments, as well as international partners, Dr. Ohieri says there's more to be done.
Our weakest link is not here. Our weakest link is in the north. So the challenge is you have the experience. You have the expertise. We need your help, advice, training, whatever. But we need to collaborate. But first, we must say thank you.
This match seemed not to be lost on the visiting team.
Our desire from the U.S. side to collaborate with Nigeria, to continue collaboration as much as possible. Both technical and kind of political collaboration. And I would say that it's not necessarily just technical assistance. I think it's a two-way street. I think that we have a huge amount to learn from you, from each of your stories, from what happened, from what some of the successes were, and what's challenges that you saw and then overcame.
For some of those in the thick of things then, totally overcoming the challenges they faced with Ebola will take some time.
It was a horrible experience because I was unconscious for 2 days. I didn't know when they brought me there. So it was later I regained consciousness. I looked around. It was Dr. Ada. I asked, "What are we doing here?" She laughed and started explaining everything to me. She told me to read my Bible, do this, do that. Then Justina was battling with herself. So it didn't take time, she died. I think she died in our presence too.
You can imagine, it's not something I can capture in 2 minutes, but seriously, it was something that friends stopped calling me. The ones that used to hang out with me stopped hanging out with me. Meetings that I used to attend, I dare not tell them that my wife had Ebola.
So far, we are recovering. And I thank God that Nigerians are getting educated. We thank God for the hospital. They've been immense help for us.
Some of us are still feeling the pain. And unfortunately, the federal government, we didn't feel their assistance. Lagos state government, they supported us, but the federal government, nothing like encouragement, no support.
For First Consultant Medical Center and all those involved in the containment of the 2014 Ebola outbreak in Nigeria, they have done their best. What is left is for everyone to imbibe the lessons learned during this period in order to ensure that Nigeria and indeed the people are better prepared in case of any unforeseen public health challenge. Yomi Otaigbe, reporting for Channels Television News.